If you want to be healthier, yet you just don't know what to do, all these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
What is up, you guys, and welcome to GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Cynthia, and happy Monday, everyone. I hope you all are having a very strong start to your week. I know I am, although I will admit I am let me be real with y'all. I'm pretty tired right now because I always do this, and it's my own fault. I usually have to wake up at 4 a.m. on Mondays because I teach a strength training class at 5 a.m. And, the night before, I should be getting to bed around latest 9. I try to give myself that time frame. Ideally 8, because 8 p.m. to 4 a.m., that's 8 hours. But it's so hard for me to try to get myself to go to bed that early. I don't know. Any of my 5 a.m.ers listening right now, is it challenging for you to put yourself to sleep? What are your ways? Let me know in the comments. I might dedicate an entire episode to how to get ourselves to go to sleep soon because I have the hardest time trying to go to bed. And then at times, I whip out my phone and I'm scrolling through Twitter, and that keeps me up. And, I didn't go to bed till 10:30, which is early for some, but for someone who has to wake up at 4 a.m, it was a pain. Trust me. I had to crawl myself out of bed this morning and put my clothes on and get to work. But once I'm at work, and I teach back-to-back strength training classes. So it's that's fine. While I'm training, I'm on the go, I'm focused. But it's the second I have a moment to myself, the second I have a little break, that's when it all comes crashing down, right? I'm sure most of you have felt the same way as I have. And oh my goodness, it's terrible. I hate having breaks. And I have a break, a 2 to 3 hour break from when my last class ends to when I start recording for this episode. So in those 3 hours, that's when I just start falling asleep, but I don't want to fall asleep because I want to mentally prepare for my episode today. And it's just a continuous cycle. Am I ever going to learn from this mistake? I don't know. Probably not, but I'll definitely give it a try. But with all that being said, I am super excited to talk about this specific wellness subject. I feel like just over the recent years, it has skyrocketed in popularity. The first time I heard of cryotherapy, I probably have heard about it. The first time I heard about it was a year and a half ago, I'd say, or a couple years ago. And it was when I used to live in the Bay Area. I went to the 49er Fit Gym. I had a week-long free pass thing. So I went ahead and tried it. And at that specific gym, they have a cryotherapy room or session. So basically your entire body is at an extremely cold temperature, very low temperature for about I don't know, not that long, like a couple minutes or so. And cryotherapy has been said to, like increase metabolism, raise collagen production, reduce inflammation. It's supposedly really good for, targeting that stubborn fat. So all of these like benefits. And I started following a lot of like fitness influencers and just fitness trainers on Instagram, and a few of them I saw, they would do this cryotherapy, and it's basically like, I like to think of it as like a really tall hot tub, but instead of water in the tub, it's just steam, but really cold, like vapor, I'd say, if that makes sense. So like in all the videos, and everything people post, it's like the tub, air quote tub, pretend, visualize here with me, people. The tub goes up to their chins, and it's just their head that you're able to peek through. And it's cold vapor basically like releasing into the body, and it's really cold. And within those 2 to 3 minutes that these individuals are in cryotherapy, again, they're supposedly reducing inflammation, releasing endorphins, boosting energy, metabolism, all of those things. And so that was my first time like hearing about cryotherapy. And again, I've never personally tried it. Am I open to try it? Absolutely. I want to see, how does it feel? Like, what's my reaction to being in extremely cold temperatures? By the way, you guys, I am not a fan of cold, okay? I don't like being cold. I don't like shivering. I prefer the heat. So this will definitely be an interesting experiment for me to try. And I'll definitely keep you guys posted once I get my first cryotherapy session in. Unfortunately, with all the COVID stuff, I'm not really sure if there's a lot of wellness centers that are offering cryotherapy. I don't know. Everything's just so up in the air right now, right? Like some places are open, some are not, some are open, but really low key. I don't know. I just like go to work and come back home, and that's it. I don't really try and go anywhere right now. But once Miss Rona decides to leave and let us regain some of our freedom back, I'm definitely down to try the whole body cryotherapy. And how I came across this topic was over the weekend, or how it like popped in my mind basically. I was looking at IV drips because I'm interested in getting someone to come to my house and give me an IV drip. And I am going to talk about IV drip in my next episode later this week. So definitely stay tuned for that. And I found this hyper wellness and cryotherapy center here locally to me. And I was just reading about the services, and that's kind of how it re-sparked my interest, because I kind of forgot about cryotherapy, and I'm like, let me dedicate an episode to this, because I'm sure all of my health and wellness lovers, freaks out here that are listening to me, you probably have heard of this term, or maybe you've never heard of this term, and you're now getting intrigued by me bringing up this subject. So this entire episode is going to be dedicated to just that, cryotherapy. We're going to be hitting, the basic overview of what it is. We're going to be discussing the benefits, some of the risk and side effects. What are the tips and guidelines from health professionals as far as how to gain the most out of cryotherapy, and just like the key takeaway points, and as well as a little bit of alternatives such as cryotherapy facials, local cryotherapy, and so much more. So definitely stay tuned till the end. And let's first get into what exactly is cryotherapy, right? Because I gave you guys, in my words, a basic visualization of what it is. And if you've tried cryotherapy, I definitely want to hear from you. Let me know in the comments, what was your experience like? Would you do it again? What were some of the side effects you experienced, good or bad? I definitely am interested. I'm sure many of the listeners are as well. So cryotherapy literally means cold therapy. And it's a technique where the body is exposed to extremely cold temperatures for several minutes. Cryotherapy can be delivered to just one area or you can opt for whole body cryotherapy. Localized cryotherapy can be administered in a number of ways, including through ice packs, ice massage, coolant sprays, ice baths, and even through probes administered into tissue. So if you are an athlete, or even if you're not an athlete, if you got injured before when you were little and, had a scrape or something, you had to put in a cold ice pack, then you at some level have already experienced cryotherapy. So you don't need to go into this, as my take, I would say, these very tall hot tubs or cold tubs in order to gain the experience of cryotherapy. If you have already used an ice pack to reduce inflammation in your joint or something, then again, you have experienced to some degree cryotherapy. So you guys, I'm going to come to a very brief break right now. And when we come back, more on what is cryotherapy.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
What's up, you guys, and welcome back to GSMC Health and Wellness Podcast. So we just got done going over, in, the most basic terms, what cryotherapy is. And in the most simplistic terms, it literally means cold therapy. And this can be administered in a number of ways, again, including through ice packs, ice massage, coolant sprays, ice baths, and even through probes administered into tissue. So you don't need to go to an actual hyper wellness or cryotherapy center to receive cryotherapy. The theory for whole body cryotherapy, also known as WBC, is that by immersing the body in extremely cold air for several minutes, you could receive a number of health benefits. The individual, so this is basically the procedure, the individual will stand in an enclosed chamber or a small enclosure that surrounds their body but has an opening for their head at the top. The enclosure will drop, you guys. It's actually ridiculous how cold it is. Listen to this. The enclosure will drop to between 200 to 300 degrees Fahrenheit, and they'll stay in the ultra low temperature air for between 2 and 4 minutes. Can you imagine being in those temperatures, you guys? Negative 200 to 300 degrees Fahrenheit. And in Celsius, that's even lower. And I can't even, oh my God. See, that's the thing. It's like, I feel like cryotherapy will literally make me cry. I don't know, guys. Like, I want to try it, but reading that just like gave me goosebumps. How am I supposed to survive in that low of temperature for 2 to 4 minutes? Like, that is insane to me. I start shivering if it gets below like 70 degrees. I know, typical California girl here, but for real, that is insane. Negative 200 to 300 degrees Fahrenheit. Wow. And you can get benefits from just one session of cryotherapy, but it's most effective when used regularly. I'm assuming just, with almost anything, any type of procedure that you do, you want to stay consistent and on some type of regular schedule. Some athletes use cryotherapy twice a day. What? Twice? Ooh, okay. So yeah, some athletes use cryotherapy twice a day, which makes sense. They're putting their body under a lot of stress, a lot of tension. And if, it's claimed to help inflammation and that seems like a good choice. Why not do it twice a day? Others will go daily for 10 days and then once a month afterwards. So I guess it really just depends what I'm assuming your athletic trainer recommends or what your doctor recommends if your main goal is to reduce inflammation as an athlete. So with all that being said and us finding out exactly the extremely low body temperatures you have to be in this enclosed chamber, let's get into some of the benefits of cryotherapy. And the first one is that it is said to reduce migraine symptoms. Cryotherapy can help treat migraines by cooling and numbing nerves in the neck area. And one study found that applying a neck wrap containing 2 frozen ice packs to the carotid arteries in the neck significantly reduced migraine pain in those tested. It's thought that this works by cooling the blood passing through intracranial vessels, and the carotid arteries are close to the skin surface and accessible. So I actually have a couple friends who suffer from very severe migraines. So cryotherapy can definitely be of use and help reduce some of those symptoms. Second, cryotherapy is said to numb nerve irritation. Many athletes have been using cryotherapy to treat injuries for years. And one of the reasons why is that it can numb pain. The cold can actually numb an irritated nerve, and doctors will treat the affected area with a small probe inserted into the nearby tissue. And this can help treat pinched nerves or neuromas, chronic pain, or even acute injuries. So again, this is more of this wouldn't be in the enclosed chamber. This is more localized cryotherapy in which they are using a small probe and inserting it into a nearby tissue in the small area of the body, not a whole body cryotherapy, if that makes sense. Next, cryotherapy is said to help treat mood disorders. The ultra cold temperatures in whole body cryotherapy can cause physiological hormonal responses. So we're now talking about being in the enclosed chamber. This includes the release of adrenaline, noradrenaline, and endorphins. And endorphins, that's the brain chemical that releases, after a good workout and literally makes you happier. So that's also what whole body cryotherapy provides as well. And this can have a positive effect on those experiencing mood disorders like anxiety and depression. One study found that whole body cryotherapy was actually effective in short-term treatment for both. Again, because it releases endorphins, adrenaline, noradrenaline, and that basically cancels out the brain chemicals, stimulants that are produced from having anxiety and depression. Next amazing benefit of cryotherapy is said to reduce arthritic pain. Localized cryotherapy treatment isn't the only thing that's effective at treating serious conditions. One study found that whole body cryotherapy significantly reduced pain in people with arthritis. They found that the treatment was well tolerated. It also allowed for more aggressive physiotherapy and occupational therapy as a result. This ultimately made rehabilitation programs much more effective, incorporating whole body therapy into these people who experience pain due to their arthritis. Next, cryotherapy is said that it may help treat low-risk tumors. Targeted and localized cryotherapy can be used as a cancer treatment. So in this specific example, we're not talking about the whole body cryotherapy in the enclosed chamber. We're talking about targeted, localized cryotherapy. And in this context, it's called cryosurgery, which we will also get into the later segment and talk about what exactly is cryosurgery. And it works by freezing cancer cells and surrounding them with ice crystals. It's currently being used to treat some low-risk tumors for certain types of cancer, including prostate cancer. Next, cryotherapy is said that it may help prevent dementia and Alzheimer's disease. Now, for this specific one, it is definitely a claim. While more research is needed to evaluate the effectiveness of this strategy, it's theorized that whole body cryotherapy could help prevent Alzheimer's and other types of dementia. It's thought that this may be an effective treatment because the antioxidative and anti-inflammatory effects of cryotherapy could help combat the inflammatory and oxidative stress responses that occur with Alzheimer's. So again, it's more research needs to be evaluated, more science-based backed research needs to be applied for this specific claim. But many scientists theorize that because cryotherapy has these effects of reducing inflammation, reducing pain, that it can also be applied for Alzheimer's, since that is also an inflammation issue. And then lastly, final benefit that we'll get into in regards to cryotherapy, it treats atopic dermatitis and other skin conditions. Atopic dermatitis is a chronic inflammatory skin disease with signature symptoms of dry and itchy skin. Because cryotherapy can improve antioxidant levels in the blood and can simultaneously reduce inflammation, it makes sense that both localized and whole body cryotherapy can help treat atopic dermatitis. Another study that was studied in mice, by the way, examined its effect for acne, targeting the sebaceous glands. And again, the results were that the inflammation reduced and that the skin condition was improved. So to summarize the benefits of cryotherapy, I say that the main benefit that you can expect from cryo is that it is amazing for reducing inflammation. Whether you're an athlete or not, whether you're, someone who goes to the gym regularly, or just you're a post-op patient trying to supplement, physical therapy, cryotherapy seems like anybody and everyone can benefit from this literally refreshing experience. So you guys, I'm going to come to a very brief break right now. And when we come back, we're going to get into some of the risks and side effects of cryotherapy. We'll be right back.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Hey guys, and welcome back to GSMC Health and Wellness Podcast. So we're now going to dive into some of the risk and possible side effects that some people may experience as a result of utilizing cryotherapy. Again, I feel like with anything new that you try or anything that you just do in general in life, there's always some possible risk factors to take into account and, just be aware of. The most common side effects of any type of cryotherapy are numbness, tingling, redness, and irritation of the skin. And these side effects are almost always temporary. It's nothing, that you should be super alarmed about. You probably have experienced this just from putting an ice pack, on somewhere on your body. Like when I one time smashed my finger on the car door. I know, absolutely terrible. And I was icing my finger to, numb the pain and to reduce the inflammation in my finger. And of course, it's like it almost burns because it's so cold. You're applying that pressure and it's just penetrating into the skin. And again, these side effects are common whether you put an ice pack, you do the whole body cryotherapy, or you do the localized targeted cryotherapy. You've 9 times out of 10 have experienced one or if not all of these side effects. And again, they're almost always temporary. However, if they do not go away, if like the tingling, the redness, the numbness, or the irritation of the skin does not go away within 24 hours, then definitely hit your doctor up, okay? Call him up, call her up, and, check it out. Also, it's recommended that you should never use cryotherapy for longer than is recommended for the method of therapy you're using. So, for whole body cryotherapy and, when you're enclosed in that chamber and only your head is popped out, in the whole body cryotherapy, there should be, it would be no more than 4 minutes. So if you do whole body cryotherapy, do not push it and try to go for 5 minutes, not even that long. So if you're using an ice pack or, you're doing an ice bath at home, or athletes, you're doing an ice bath after practice, you should never apply ice to the area for more than 20 minutes. So 20 minutes is the cap. Take that ice pack off, get out of that ice bath, and also just for those who do not already do this, wrap your ice packs in a towel so you don't damage your skin. So don't directly apply like an ice pack onto your skin. If you've done it, then you probably know it literally hurts when you take the ice pack off because it sticks to your skin and it's just a pain in the where trying to take it off. So again, just a little reminder here for you guys. When using an ice pack, wrap it in a towel first, then place it on top of the skin, and don't leave it on for any longer than 20 minutes. Same for the ice baths, no more than 20-minute ice bath. In addition, people, those with diabetes or any conditions that affect their nerves should not use cryotherapy, okay? They may be unable to fully feel its effect, which could lead to further nerve damage. So somebody who has, some type of condition that affects their nerves, and they go into a cryotherapy session, like a whole body cryotherapy session, they, after the 4-minute mark, they may not feel any numbing or tingling, or, maybe they may not feel anything. And they decide to stay there for longer, like say 5 minutes. And even just that extra minute can further lead to more nerve damage. And that is exactly what we do not want. We do not want that. So again, take the proper precautions when doing these treatments. And again, just be safe, not sorry. Check in with your doctor, okay? They will tell you what is good for you, what you should try, what you shouldn't try. Now, I want to get into some of the possible risk factors when it comes to utilizing cryotherapy for individuals who have cervical cancer or post-op, kicked cancer in the ASS, beat it, and do not have cancer anymore, but were cervical cancer survivors. So here's some things, some side effects that you may experience if you have cervical cancer. Only for those who have cervical cancer. If you are a male, these side effects will not apply to you, and you will hear exactly why. After cryotherapy, for those, again, who have cervical cancer or had cervical cancer, you'll have some watery discharge that may last from a few days to several weeks. Other problems are very rare, and most of the time, cryotherapy is very effective for these types of patients. So, what do you need to do after cryotherapy treatment? After cryotherapy, again, you'll have watery discharge that can last from a few days to several weeks. Your discharge might be heavy and there might be a little blood in it. So just be sure to drink lots of fluid to replace the water you're losing. Your doctor or nurse may tell you to not douche or use tampons for several weeks after cryotherapy. And they may also tell you to wait a while before having vaginal sex. And this is because this gives your cervix time to heal and lowers your chances of infection. So I do want to put out or state that this watery discharge that these patients may experience after a cryotherapy session are completely normal. This is expected out of patients who have or had cervical cancer. So don't be alarmed. Again, just drink lots of fluids, lots of water to replace the water that you are losing through the discharge. So again, cryotherapy is safe. Most people don't have any serious cryotherapy side effects. Again, very rarely. However, problems can happen. And for cervical cancer patients, some of these problems can include fainting, flare-up of an existing pelvic infection, heavy bleeding, freeze burns in the vagina, and those are possible side effects. Now, these next few problems or issues or side effects that you experience after a cryotherapy session, if you experience any of these, definitely call your doctor right away. If you have heavy bleeding, if you have severe pain in your belly, if you have a fever of 100.4 degree Fahrenheit or higher, or if you have chills, or if you have vaginal discharge that smells bad. Cryotherapy shouldn't affect your ability to get pregnant in the future unless a very rare complication occurs. In a small number of cases, cryotherapy doesn't completely remove the abnormal cells. And this is more likely if the abnormal cells are deep in your cervix. And if this happens, you might need to get cryotherapy again or, use a different treatment. So, one last thing in regards to using cryotherapy during pregnancy. Is it safe? Can you do it? Doctors say and usually wait until after you give birth to treat abnormal cervical cells. So delaying treatment is usually safe because it generally takes a long time for abnormal cervical cells to become cancerous. So if you're pregnant, doctors recommend that you wait until after you give birth to utilize the treatment. So again, all of the side effects I just listed right now, as far as like the watery discharge and all of that, that is only applies to those who, have cervical cancer, had it, and the more normal side effects, the more expected side effects of numbness, of that the rest of the population that can expect from a cryotherapy session, such as numbness, tingling, redness. Those are pretty normal and are temporary effects of utilizing the cryotherapy. So again, if you have any conditions you want to treat with cryotherapy, make sure you discuss them with the person assisting you with or administering your treatment. It's always a good idea to consult your doctor before using any type of therapy, whether it's cryotherapy, IV drip therapy, which I'll get into next week, or whatever type. Always consult with your doctor. And just a few tips and guidelines for those who are going to do cryotherapy. If you're receiving whole body cryotherapy, make sure to wear dry, loose-fitting clothing. Bring socks and gloves to protect from frostbite because it is negative 200 to 300 degrees Fahrenheit. I'm sure most of these clinics offer you gloves and socks anyway. And during therapy, move around if possible to keep your blood flowing. So it's recommended to not just like stand there. So you guys, I'm going to come to a very brief break right now. And when we come back, we're going to start talking about cryosurgery.
The GSMC Life and Happiness podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
What's up, guys, and welcome back to GSMC Health and Wellness Podcast. So we're now going to be diving into the subject of cryosurgery. We'll get into what it is, the purpose, what is the procedure, the preparation, the risk, all of that good stuff we're going to discuss right now. So for those of you who don't know, I didn't know this about a few days ago, so don't worry if you don't know what cryosurgery is. Never heard of it. Cryosurgery is a type of surgery that involves the use of extreme cold to destroy abnormal tissues such as tumors. And the surgery most often involves the use of liquid nitrogen, although carbon dioxide and argon may also be used. When liquid nitrogen has a temperature between negative 346 and 320 degrees Fahrenheit, it instantly freezes nearly anything that's in contact with. And in the case of human tissue, it can kill and destroy cells upon contact from how extremely cold it is. I mean, negative 346 degrees, that's pretty freaking cold, right? And this is important when the cells you want to kill are cancerous. You want to freeze it. You want to kill it, right? You want to destroy these abnormal cells, cancerous cells. Cryosurgery is typically used for tumors or precancerous lesions found on your skin. However, some tumors inside the body can be treated this way as well. Advances in cryosurgery technology have dramatically reduced the long-term side effects once associated with the treatment. More studies are needed on the long-term effects and effectiveness of cryosurgery. So, again, cryosurgery, also known as cryotherapy, is similar to the technique used when doctors freeze off warts using liquid nitrogen spray. If you ever had a wart, then you probably are a little bit experienced with cryosurgery, my sister, I'm about to put her on blast right now. My sister had a fat wart on her toe and it was so gross. I'm sorry, sister, if you're listening to this. And she literally got it freezed off using a liquid nitrogen spray. And that is a form of cryosurgery. So why is cryosurgery, being performed? Does it work? Let's get into it. Cryosurgery is used to destroy problem tissues in the body. In most cases of cancer, it's not the first line of defense though. However, it can be used when other forms of treatment have proven unsuccessful, especially if the cancer has returned following other treatments. So cryosurgery is not the first pit stop, right? That's if other alternatives have not worked, then cryosurgery can be another solution. Cryosurgery is most often performed to treat cancers or precancerous lesions on the skin. It is, however, used on some internal organs such as the liver when disease and other problems make conventional surgery difficult or risky. Cryosurgery is used as a primary treatment for early prostate cancer that's contained in the prostate, and it's also performed when cancer returns after other therapies. So with all of that being said, we talked about the purpose. Cryotherapy can be used to freeze off a precancerous or cancerous cell lesion onto the skin, and at times even inside of the tissues of the body. So what are some of the risks associated with cryosurgery? Cryosurgery does have risks, but the good news is that they're considered lower than other cancer treatments, such as surgery or, radiation, which I feel like a lot of people tend to go for radiation as the first pit stop in trying to kick cancer in the ASS. So some of the risks associated with cryosurgery include blisters, damage to nearby healthy tissue or vessels, infection, a loss of sensation if nerves are affected, pain, scarring, sexual dysfunction, ulcers, and white skin at the site of the surgery. So those are some of the risks, but again, they're considered lower than other cancer treatments. That's not to say that these aren't bad, like having blisters and infections and pain, like nobody wants any of those things, right? But if we're comparing those risks compared to risk of using chemotherapy, then, they're significantly lower. So how would you prepare if, say, you are someone who's thinking about cryosurgery? What is the preparation? What does it look like? Your preparation for cryosurgery depends on the type of cryosurgery being performed. Cryosurgery for skin cancer, which is the main reason cryosurgery is used, requires little preparation on your part. If your doctor is treating an internal organ with cryosurgery, you'll probably be given the same instructions that you'd get before traditional surgery. Things like you'll be asked to fast for 12 hours beforehand and, no water or anything like that to reduce nausea, and arrange for a ride home from the procedure. So typical things of surgery. And before the procedure, tell your doctor if you have an allergy to anesthesia, as well as any and all medicine you're taking, including over-the-counter medications and nutritional supplements. From there, your doctor will provide you with complete instructions for preparing for the surgery, and, obviously it's important that you follow them. So how is cryosurgery performed? Your doctor will place liquid nitrogen on your skin using a cotton swab or spray. A numbing medicine may be used to prevent any pain or discomfort. If an internal area is being treated, your surgeon will use a scope, which is a flexible tube that can fit into various openings in your body, such as the urethra, rectum, or a surgical incision. The liquid nitrogen is fed to the area under treatment and applied to the targeted cells. The cells freeze, die, and then will be slowly absorbed by your body. Your doctor will use imaging equipment such as an ultrasound as a guide for carrying out the procedure and seeing, where this flexible tube scope, is entering it throughout your body. So now following up after surgery. So we talked pre-surgery, intra-surgery, during surgery, now post-surgery. After most cryosurgeries, you're able to go home that same day. So you don't have to stay in the hospital for a couple days unless there are some rare complications going on. After the procedure, you'll need to care for any incision wounds or places where the skin has been frozen. Your doctor will give you instructions. Care typically involves keeping the area free of contaminants and changing the bandages to prevent infection. You'll have follow-up appointments in which your doctor will determine how successful your treatment was, if you have any complications, and whether you'll need more cryotherapy. So I feel like pretty basic in terms of, it sounds about the same as any other surgery you would get, whether it's cosmetic or not. It seems kind of about the same. To be honest, I've never gotten surgery ever in my life, like not even to get my wisdom teeth pulled out. So I can't really speak from personal experience, the surgery procedure preparation, but I do watch a lot of YouTube and I do watch a lot of cosmetic procedure videos. I like seeing people's journeys. What's their post-op like? What was the preparation like, during like? And most of their care, their aftercare is about the same as cryotherapy. So it's really not that different compared to other types of surgeries. Again, I wouldn't know because I've never had surgery. So you guys, I'm going to come to a very brief break right now. And when we come back, we're still going to be talking about cryotherapy, but switching lanes a little bit and talking about cryofacials. We'll be right back.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Hey guys, and welcome back to GSMC Health and Wellness Podcast. We're now entering our final segment for today's episode, and we're going to be discussing cryofacials. Can you guys guess what it is? I feel like you all can basically guess what it is. You're essentially just like freezing your face, okay? And for any of you wondering what on earth is a cryofacial, it's basically dry ice that's pumped out of a hose and onto your skin. In other words, cryotherapy for your face. And a cryofacial is a 10-minute cryogenic treatment in which vaporized nitrogen is used to freeze or hypercool the skin of the face, scalp, and neck area. And during the cold therapy technique, the body is exposed to extremely low temperatures for several minutes, and is used for everything from weight loss to inflammation reduction. And as it turns out, the brightening, energizing, and lifting benefits extend to the face too. So that's the main reasons why people like doing cryofacials. It's supposed to brighten, energize, and lift the face. Other benefits of a cryofacial include that tightening of pores, it fills in fine lines, it soothes the skin, it increases collagen production. A cryofacial sounds a bit like a dangerous science experiment, honestly. Like, freezing my face off doesn't sound too fun, but I also will do anything for perfect skin. But it's been said that the benefits are unreal. As Bookout explains, the cryofacial will rejuvenate the skin with benefits including reduced inflammation and puffiness, increased collagen and elastin production, improved skin tone and texture, a reduction in fine lines and wrinkles, and reduced pore size. The goal of the liquid nitrogen is to help tighten pores, soothe inflammation, and fill in wrinkles, which it may do, much like giving your face an ice bath in the morning. That's why, from just my experience of reading articles and watching YouTube, a lot of people have recommended that in the morning, splash your face with cold water. It's supposed to wake you up, energize you, and also to tighten your pores. It also helps encourage lymphatic drainage. In fact, I was told that some women will come in wearing a full face of makeup before a night out and get the treatment to make their skin glow like crazy. And the treatment has gotten praise from celebrities like Jennifer Aniston and Gigi Hadid. And just random, by the way, Gigi Hadid reportedly got a full body cryotherapy treatment before the Victoria's Secret fashion show in 2015. She was nice and tight and cold and ready to walk that runway. So what's the difference between a cryofacial versus a standard facial? Because it utilizes cryotherapy, a cryofacial is decidedly chillier than a standard treatment with steam and hot towels. Depending upon where it's performed, it might not be a spa-like either, and it will likely require the use of glasses to protect the eyes. So what to expect during a cryofacial? The day of the facial, this is from the founder of Allies of Skin. His name is Nicholas Travis. And Nicholas Travis honestly swears by his own products to achieve his otherworldly glow. And his products, he uses Molecular Multi-Nutrient Day Cream, an overnight mask, and Molecule Savior Repair Mist. And all of 3 of these products are incredibly hydrating and glow-inducing. So pairing them with an ice-cold facial only seems like proper protocol for, perfect skin. So the aftercare, what it's like, there's really no need for aftercare. That's the great thing about this cryofacial. The cryofacial is very versatile and non-invasive, and most women elect to keep their makeup on during the facial, then quickly go on with their day. Again, because you're not doing, it doesn't involve hot towels. They don't need a rub or anything. It's literally this tube that is spraying ice cold vapor on your skin. So you can do this in makeup and go on with your day. So that's pretty cool, right? And as far as safety, cryofacials are generally safe. In rare cases, it can cause numbness, tingling, or frostbite, similar to whole body cryotherapy. Same thing applies to cryofacials. And just make sure you're seeing a trained professional that you feel comfortable with. With anything, you always want a professional when it comes to these type of things. And especially just anyone who's handling your skin. Girl, you don't want just anybody touching your face, okay? Do your research, look up their credentials, look up the studio clinics credentials, all of that good stuff, because that all matters. So let's talk about the price point for this, because it is pretty pricey, but all facials are pricey, honestly. The price of cryofacials ranges, but they're generally considered to be one of the more affordable facial options, and they can range anywhere from $40 to $150 or more per facial. I'm just going to assume and say that the $40 facials is a one-time usage, and the $150 price point is if you buy a package. I don't know. I'm not an esthetician. I've never gone to cryofacial, so that's just my idea from those price points. So who's an ideal candidate for receiving a cryofacial? Cryotherapy facials, again, they're a non-invasive cosmetic procedure, and unlike certain like chemical peels, microneedling, or microdermabrasion, they won't leave your skin looking red or raw. So really, anyone who wants a glow is a good candidate for a cryotherapy facial, especially those who feel that their skin looks tired or dull. And of course, if you're pregnant or nursing, it's always best to check in with your doctor before getting a cryofacial. Again, better safe than sorry. So what to expect during the procedure? When you arrive for your appointment, the practitioner will go through several steps to get you ready for your cryofacial. And this procedure generally goes as follows. First, your face will be thoroughly cleansed and dried. Some practitioners like to steam the face or do a gentle massage for lymphatic drainage before the cold part begins. They'll likely ask you to remove any jewelry and give you goggles to wear. You'll feel liquid nitrogen hitting your face from a hose, and trust me, it will definitely feel cold, like sticking your face in a freezer, but it shouldn't be unbearable. The hose will cover your face for about 3 minutes, similar to a whole body cryotherapy session. And some people actually find the sensation relaxing of a cryofacial. So I'm assuming it doesn't go, in negative 200 degree Fahrenheit temperature, like in a whole body cryotherapy. And then the technician will then apply a moisturizer or a serum on your face. And in some cases, they do a second facial, and then you're good to go. So it's fairly quick. Again, it's non-invasive. You can do this in and out. I'm assuming that if you do cryofacials, you're able to do this in, 30-minute appointments or less. I don't know. If you're an esthetician and you perform cryofacials, let me know in the comments, because I'm not 100% sure, okay? So, you guys, that's going to wrap up today's episode here at the GSMC Health and Wellness Podcast. I really hope you guys enjoyed this discussion of cryotherapy. If you have tried cryotherapy, again, please let me know in the comments, what was your experience like? Would you do it again? Would you recommend it to your family and friends? And also, why do you do it? What is your specific purpose for utilizing cryotherapy? Do you want to reduce inflammation in your joints? Do you want to, increase your endorphins? What is it that you expect? So there is plenty of anecdotal evidence and some research supporting the claims that cryotherapy can offer health benefits, but whole body cryotherapy is still being researched. And because it's still being researched, again, talk to your doctor or healthcare provider to assess whether this is the right choice for you. So if you liked today's episode, please don't forget to like, share, subscribe, comment, all of that stuff, because that tremendously helps the show. And I'll catch you guys here for the next one.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.